My name is Hamis Mugendawala, and I work for the National Planning Authority. Your question of whether do we treat universal health coverage as a planning issue, I would say, and I would affirm with a big yes. Of course, when you look at our planning frameworks now, our intention is to have at least 70% of most of the Ugandans having access to unconstrained health and without the constraint of finance. And we are as well targeting or planning to target at least having 50% of our population having financial protection towards achieving health. Now, I'll give you a story to begin with. Last week, in the newspapers and on TV, you saw an ugly picture of a man who was dragged out of a hospital on a life support machine, and the hospital asked him to first pay before they would work on him. He was on life support machine. He was bundled on an ambulance and dragged into a bank, and he had to be supported to sign to get the money, and then they took him back to the hospital. Unfortunately, this man passed on yesterday. His name was John Rabazungu, something of the sort. Still last week, our executive director got a health complication and was admitted in one of the biggest hospitals around. When we went to check on him as the chief planner, next door, there was a man whose bill had risen astronomically, and outside they had put his very expensive car for sale such that they would work on him. These experiences, to me as a planner, showed the distance between our envisaged achievement of the universal health coverage and where we are now. From the planning perspective, of course, we believe that universal health coverage is the way to go, and that's why National Planning Authority is part of this consortium working to achieve the universal health coverage. What we believe is that before we even think of diving deep into how we can mainstream the UHC within the planning frameworks, we must ensure that we raise awareness. As NPA, we are arguing the different sector players to raise awareness about universal health coverage and define it in the lay terms for people to have a common understanding of this concept. Those who have been reading newspapers, you already realize that the concept of UHC has already been vulgarized, and we might lose it out if we do not stand up to explain it clearly. Fortunately, of course, the School of Public Health is trying as much as possible to dissect and explain it in the lay terms, but there is a kind of narrative that is going around that is vulgarizing UHC to be synonymous with just health insurance, not knowing that that is just a very small component. And so it is upon us, beyond even the planning authority, to raise this awareness such that people can hold a common understanding and appreciate the universal health coverage concept. And that would be the beginning of the mainstreaming, because from my experience, people do what they have heard or what they have seen and what they understand. They don't do anything outside that. Now, after causing that common understanding through raising awareness, the next logical step from the planning perspective is taking the programmatic approach to the planning, budgeting, implementation, and monitoring of UHC. What do I mean by this? We must focus on overarching priorities that we believe are high impact, that can lead us to achieving UHC, that are above any sector. Because as you know, there is no sector that can claim that it can give health. Why? Because health is made and destroyed in very different places. And so it should be mended in very different places, rather than always thinking that the Ministry of Health is the one to mend our health. So we must take a programmatic approach to the planning, the budgeting, and monitoring of universal health. Now, we are writing the National Development Plan 3 now, and the universal health coverage is a sub-program in there. And we are indicating, or we are sending signals and saying that some of the most high impact interventions that could lead us towards universal health coverage, that where we would leverage on most of our efforts, it mainly around 3 aspects, besides the other business as usual. We are realizing from the planning perspective that we must, as a matter of urgency, invest in interventions that are going to drive the risks to health. Some people may call them prevention, because we are realizing that the cost of ill health exceeds our capacity to reverse it. And so we must invest in driving down the risks of health. The other pointer or high impact aspect that we, from the Planning Authority, are focusing on as we move towards universal health coverage is the investment in functionalizing the health facilities that we do have. We must applaud the Ministry of Health with regards to setting or laying the physical infrastructure on ground. And from the statistics that I've read, maybe it could be an old statistic, it is indicating that at least 75% of the population live within 5 kilometers to the health facility. And that is, to me, it's quite impressive. But then the complaint, or anyway, I wouldn't call it a complaint, but what is coming out is that while we have these magnificent facilities on ground, they are not functional as expected. And so, from the planning perspective, we are indicating that we must ensure that these facilities are functional as intended. And specifically, we must strategically invest in human resources for health. Good enough, the Ministry of Health or the health sector and National Planning Authority and MaxPH have already started working on the National Human Resources Plan for Health, which is going to anticipate the kind of the quantity and quality of human resources that we shall need to functionalize most of the health facilities. Now, The other aspect regarding the functionalization of the health facilities points and funding, because we realize that government funding to most of these health facilities is sometimes less than 30% of what they would require. Now, this, I'm not heaping a blame on anyone, because even the richest countries cannot fully finance health. But what it's presupposing from the planning perspective is that we must explore different models of financing health. Either we decide or we create models that allow other people outside government to provide health on behalf of government and find a way of compensating them. So, the other high leverage or high impact aspect that we are talking about at National Planning Authority in the NDP3 is on this monster called policy. Now, you remember that within our constitution, there is a promise that government makes of providing the basic primary health care to the Ugandans. But here is another promise of universal health coverage to quality, equitable, and other kind of dimensions of health. Now, there is need to harmonize these kind of policy tensions to accommodate the universal healthy agenda. Now, the other aspect is the programmatic approach to budgeting for health after planning. Now, we are saying that we must encourage, or there must be a framework that makes every institution have a budget for an intervention towards health, universal health coverage. The other day, the Permanent Secretary of the Ministry of Health indicated, and she said, that health in Uganda is destroyed somewhere else, but people expect it to be mended within the health sector. And where it is destroyed, no one is willing to bear the cost. She gave an example. Within our hospital framework, most of the patients with fractured limbs get them on the road. But then if you asked the ministry or the work sector how much within their budget is towards the achievement of universal health coverage, just look at education as another sector. Within the school can make and destroy health as well. So from the planning perspective, we are saying sectors outside the health sector must be encouraged or enticed to dedicate particular budgets towards interventions within their mandates, but contribute to the universal health coverage agenda to ensure that this burden does not only fall on the health sector budget. That's all that I can say from the planning perspective. Thank you very much.
Well,